Hi, Dr. Sasse here at Sasse Surgical. So who is the best candidate for bariatric surgery? Bariatric surgery, keep in mind, is known by other names including weight loss surgery. More modern term is metabolic surgery. That's kind of our favorite in the field. So to be the perfect candidate, I guess you have to think about all the conditions, all the reasons why metabolic surgery is effective and who it might be the most effective for. I would say that let's start by seeing what do the organizational bodies, what is the NIH Consensus Conference, what do the American Heart Association, American Diabetes Association, and other experts think metabolic surgery really does for us and who it helps the most. So if we took a broad sort of scan of those opinions and those bodies that have weighed in on this, you would see quickly that it really involves a lot of people. In most cases, the framework has to do with starting with a height and weight calculation that normally begins with BMI or body mass index. So if the body mass index is over 30, then it's at least in the conversation. Certainly a body mass index over 35, considered morbid obesity, is a reason to begin thinking seriously about metabolic surgery. Most health insurance plans will cover it starting at a body mass index of 35. If there are additional health conditions such as high blood pressure, obstructive sleep apnea, or type 2 diabetes. Many others will cover it with some additional conditions such as severe spine disease, kidney problems, other obesity-related health conditions. But at a BMI of 40, nearly all health plans cover it without asking a lot of further questions. For example, Medicare, most state Medicaid programs, TRICARE, most public and private employer plans cover metabolic surgery at that BMI level. So you might start by saying, well, is my BMI in the right category where I would be the perfect candidate for metabolic surgery? And I would say if yours is over 40, then yes. Over 35, probably. Over 30, a consideration, certainly. Let's dive into that just a little bit deeper. What about people with some specific health conditions, and what about people without specific health conditions? The case is very compelling for people who already have type 2 diabetes, and the case is also very compelling for people who have pre-diabetes and whose body mass index is creeping up into the ranges I've described. I say this because there is a huge trove of worldwide literature published in the best, most prestigious medical journals looking at large trials, including the highest quality trials, those ones that are prospective randomized controlled trials, as well as large cohort studies involving populations of patients that are compared against one another that directly compare metabolic surgery to the best other treatment, non-surgical treatment of type 2 diabetes. And they all clearly show that the surgical treatment of type 2 diabetes is better, it's superior, it's safer, it improves life, improves longevity, it reduces risks of heart attack, stroke, kidney failure, blindness, and amputations. Much better than non-surgical treatment of type 2 diabetes. That fact alone means that our whole paradigm for treating type 2 diabetes is changing right now in our midst as those randomized controlled trials, and there are many of them. There were over 12 published as of 2019. I believe there are 15 completed randomized controlled trials comparing metabolic surgery to best practices, non-surgical medication, counseling, dieting, etc., treatment of type 2 diabetes. And they show unequivocally that surgical treatment is the best. So as that is getting absorbed and kind of filtering into the medical community and into the public at large, we're seeing a real shift towards surgical treatment as the best treatment of type 2 diabetes. So I would say that today in 2021, if you have type 2 diabetes, regardless of body mass index, metabolic surgery should be a consideration. Certainly if the body mass index is over 30, this is probably the primary consideration. There are still some ongoing studies. The ones that have been done to date do show that metabolic surgery is the best treatment, even at this low-ish BMI of 30 to 35. But beyond BMI of 35, there's no question anymore. That question has been completely resolved, that metabolic surgery is the best treatment for type 2 diabetes. So if you find yourself in that boat, and millions of people do, then metabolic surgery really is the best treatment and you are the perfect candidate. You could be perfect in many ways. You could say, oh, I have no risk factors for surgery. That's true. Unfortunately, that's not the way it goes in surgery. Most people don't have surgery when they're perfectly young and healthy and 20 years old and absolutely nothing wrong. Usually we have surgery a little bit later in life as more things happen, but that doesn't mean that you can't have it very, very safely. Metabolic surgery, specifically the sleeve gastrectomy, has been safer than an appendectomy, a C-section, a hernia repair, basically almost any kind of major surgery that you can name. Sleeve gastrectomy has become so regularized and routine, and it is so sort of focused, targeted, and non-invasive that it has become safer than all of those routine procedures. So that should help calibrate just how truly safe that 45-minute procedure is. So I would say you're a perfect candidate if you have type 2 diabetes and a BMI that's above normal, say above 30. What about other conditions? Well, there's a great deal of literature in the cardiology literature about people with high blood pressure, about people with other heart conditions, that they do better with metabolic surgery than without it. So as you delve into that, you'll say, well, I'm probably a perfect candidate for it if my BMI is over 35 and I have high blood pressure and I'm taking medication for high blood pressure. Or I have other heart conditions such as coronary artery disease or atrial fibrillation. There is a very good chance that you're a perfect candidate for metabolic surgery in any of those circumstances. What about beyond that, other health conditions? Well, I mentioned degenerative spine problems, orthopedic problems, severe hip, knee, and other weight-bearing joint problems. There's a good chance that your best card to play is metabolic surgery in those circumstances, which we know from experience and from large studies that reduces our risks of continuing arthritis and degenerative joint changes, preserves the integrity and longevity of the joint replacement procedures, and generally leads to a higher quality of life and functional capacity of being able to walk and do activities. So if any of those conditions are present, then there's a good chance that you're a perfect candidate for it. What about kidney problems? There is a great deal of literature showing that kidney failure ceases to develop, the progression is slowed, and the kidneys are preserved with metabolic surgery, much more so than without metabolic surgery. So once again, if your body mass index is over a normal range, let's say 30 or over 35, then there's a good chance that metabolic surgery is right for you. What about obstructive sleep apnea? Well, this is a condition that sometimes is under the radar. We know about it because people snore, but if you look more closely, they often stop breathing for long pauses. And this can lead to poor sleep, poor resting, and a lot of daytime drowsiness. It's associated with headaches in the morning. It's also associated with people falling asleep at the wheel and having fatal car accidents. Sleep apnea is not just a benign snoring disorder. It's a really serious problem that can have serious consequences. And the best treatment for it in the published literature appears to be metabolic surgery, both by inducing weight loss, which improves the condition, but also some of the direct hormonal effects that affect our sleep and our sleep drive centrally. So this list that I'm developing of all of these weight-related conditions, you can see is becoming very long. Severe headaches, migraines, something called pseudotumor cerebri or intracranial hypertension, lung disease like restrictive lung disease, liver problems such as fatty liver, congestion that begins to develop steatohepatitis and early cirrhosis, and the conditions I described that are both orthopedic and also spinal. This very long list of obesity-related conditions are usually best treated by metabolic surgery, which gets back to the root of the problem rather than just trying to go focus on doing more surgery on that affected joint or just trying to go treat with yet another pill for the high blood pressure. Metabolic surgery gets at the root cause in most cases and reduces the risk, reduces the condition, and reduces the progression of the condition to more serious health problems. So I would say the kind of the burden of proof or reason is if metabolic surgery is indeed the best treatment for each of those conditions in people with a excess weight or body mass index over a threshold number, call it 30 to 35, then really the question is, why would I not be pursuing the best, safest treatment? And if I'm close to a perfect candidate, that means that that's going to be the best treatment for me. The perfect candidate might be also somebody who is motivated to try to make the procedure successful, try their best to follow the instructions, to try to do their best with their diet, and really commit to a 7-day-a-week program where they do at least walking every day for some physical activity. But most people are not perfect candidates in terms of, being able to comply with every single piece of medical advice and having, perfect health other than the condition being addressed. So don't let that stop you from at least exploring it and getting the facts about it. Right now, metabolic surgery is woefully underutilized. The estimates are that only around 1% of people who would really benefit and for whom metabolic surgery would be the best treatment for them really take advantage of it and undergo it. A lot of that stems from the fact that despite the safety of it that I've just described, people think, and sometimes their doctors think, that it's 5 times more risky than an appendectomy or 10 times more risky than a hernia repair, when in fact it's less than each of those. And they don't understand the quality and duration and depth of research data that's been published over the last several decades showing its safety and effectiveness. Nor do they know that the American Diabetes Association and the American Heart Association and virtually every other advisory body recommend and endorse metabolic surgery for a long list of conditions, often as top-tier treatment. So as that information gets gradually more disseminated and more people understand its role, then some of our kind of preconceived notions about it will drop to the wayside, and we will begin to realize that it's just another treatment, just like other surgical interventions, other procedural interventions, other medical interventions. We'll just put it in the list amongst them and kind of drop our preconceived notions about what metabolic surgery really is. Because the odds are, if you have or your loved one has any of those conditions and they have been carrying around a significant amount of extra weight, their best card to play is metabolic surgery, and they really are perfect candidates for it. All right, I hope that's been helpful to frame the topic for you. I wish you the best of health.